Hey, Dr. Windish from Sparks Pediatric and Adolescent Medicine here. Welcome to my video series for students. Yeah, it's been a long time since I've been around. Sorry about the delays. Things are really crazy over here, and I'm no longer in private practice, so I don't exactly have the time that I used to have and the flexibility to reach out to you guys. So today what we want to talk about is the adolescent psychosocial assessment. This is an important part of a physical exam or a wellness exam or a preventative health maintenance exam for teenagers and adolescents. It should be initiated in early adolescence. Exactly when that begins is somewhat of an arbitrary time period. Some people started as early as 11 years of age. In private practice in the community I was in, I started it at 13. You really need to know your patients and when adolescence begins with them. Please realize I'm making a very strict delineation or differentiation between adolescence and puberty. They're not the same. Adolescence is that psychological developmental stage. Puberty is something strictly physiologic. Don't look at the puberty. Look at the behavioral development to decide when you need to begin an adolescent psychosocial assessment. And what I always taught my students in private practice, although I routinely begin it at 13, if I have a reason to believe I need to ask earlier, I certainly can ask earlier. In my current patient population, I don't start seeing patients till they're 16. However, if the program I work for now were to extend their accepted age limits to a much younger group, to go as young as 10 or 11. With this patient population, I'd begin the adolescent psychosocial assessment even at those ages. We use a couple of acronyms to help us remember how to do the adolescent psychosocial assessment and make sure nothing gets left out. Use whichever acronym your school teaches. The one my school taught, which was developed by Eric Cohen and Tim Worf at Children's Hospital of Los Angeles, and Dr. McKenzie as well, is known as HEADS, H-E-A-D-S-S, two S's. Some schools teach one called SHADES. I don't know what the acronym stands for SHADES, so I'm going to teach according to HEADS. Use whichever one you want. They both work well. Both assessments are designed to have the questions asked in order. They start with the least obtrusive, least personal questions, and then they build to the more obtrusive, more personal questions. This allows you to build rapport as you go and makes for a more efficient assessment and a more accurate assessment. It also sets the stage for rapport as the kids get older and as some of these adolescent behaviors become more of a problem, and consequently the value of the assessments becomes higher. In all cases, whichever acronym you choose to use, they need to be done in private. Having a parent in the room is pointless. You will not build rapport. You will not get the truth. And you'll have an assessment that's based on a lot of false assumptions. And then when you really do need to know the truth, you won't have rapport. The patient won't feel obliged to speak forthwith to you, and what you'll get will be invaluable or valueless. And like computers, garbage in, garbage out. Bad data obtained from a falsely presented adolescent assessment, bad decision making when you're writing prescriptions. All right, so HEADS. H stands for home. Now, for many patients, depending on where you are practicing, the answer to that's very simple. I live with my parents. How's everything at home? It's good. And with this assessment and with this tool, you need to ask the second order questions that follow on, so home, where do you live is the question. I live at home. Then you might need to ask second order questions. Who lives at home with you? Mom and her boyfriend. I live at home. Where's home? Home is split between mom's house and dad's house. Who lives at mom's house? Mom and her dog. Who lives at dad's house? Dad and his girlfriend and stepson. Sometimes the answers are surprising, and then you need to ask a lot of second order questions. Where do you live? I live under 4th Street Bridge. Then you need to ask, are you safe? What do you do about food? What do you do about safety? Do you have to trade sex for drugs or money or for protection, etc.? So don't limit yourself to HEADSS. You got to ask the second order questions too. They don't do any good to open a line of communication and have a patient give you a hook and in to their psychosocial problems. I live under a bridge, and say, okay, that's nice. E stands for education. What grade are you in? What about the bridge? What about living on the street? What about the fact that it's 20 degrees tonight? You have to, take all of that to the next step. I'm not going to go in detail to all of the second order questions because I couldn't begin to guess where they're all going to lead. They lead all over the place. But you, as the provider, need to take those second order questions wherever they lead, and you need to explore them. If you backtrack, if you go back to the assessment tool, to the acronym, and figure I'll come back to the bridge later, you've shut the communication with that patient down, and when you come back to it later, they're not going to open back up. You've shot yourself in the foot. So once they give you that in, you have to explore it, and that's okay. And then you come back to the acronym. So E stands for education. What grade are you in? Are you in and then some simple second order questions that might come up. Are you in regular classes, advanced placement classes, special classes? For kids who are closer to graduation from high school, what are you going to do after high school? For young adult adolescents, what are you going to do after college, assuming they're in college? What are you going to do next year? Are you going back to school? For kids who've dropped out of school, what are your plans about getting your diploma? That does two things. A, it finds out what their plans are. But B, when you ask it that way, what are your plans? Not, do you think you're going to get a diploma? Have you thought about getting a diploma? That gives them the opportunity to say, no, I'm not going to get a diploma. What are your plans for getting a diploma? They can still answer, I don't have any plans, I'm not going to get a diploma. The hook is there for them to tell you the truth. But at the same time, the seed is planted that they're going to get their diploma, which is valuable for them. How is school going? Are you bullied in school? Are you safe in school? Do you have friends in school? What do you do? Well, some of this starts to hinge on the A. But what do you do, that you enjoy at school? If you really need to build rapport, what are your favorite subjects at school? What are your least favorite subjects at school? Commiserate with them on their least favorite subject, even if they name your favorite subject. Yeah, that's a hard one. My favorite subject was math. My least favorite subject is math. Oh, yeah, math is hard. It's brutal. I loved math. Okay, I'm lying through my teeth, but build rapport. Okay, A stands for activities. What do you do when you're not in school? And what do you enjoy? That also is a beginning assessment for anhedonia. I don't enjoy anything. And, nothing provides you pleasure? Nope, absolutely nothing. All right, now we need to really look at depression too. But it also gives you an in to figure out, what do they do in their spare time other than behaviors that we might determine value judgment-wise to be somewhat deviant, Also gives you an in to anxiety. I'm captain of the cheer squad. I am captain of the debate team. I am the editor of the football team or the newspaper and the yearbook. And I'm in scouts. And I work part-time. And I'm anxious. You start to understand where that's coming from and getting into their thinking. So it works both ways. So that's the A, activities. D stands for drugs. So do you smoke, drink, use any other substances? And then all of the second order questions that come from that, including cage questionnaires for alcoholism, etc. Counseling, brief counseling about quitting smoking, drinking, substance abuse, etc. So that's HEAD. The first S is for sexuality. Do you have sex with men, women, or both? Are you interested? No, I don't have sex. Are you interested in men, women, or both? In the modern era, we also need to ask about sexual identity. Do you identify yourself as male or female? And I always use this opportunity with girls to get a menstrual history as well. You got to get it at some point in time, and this often to me seems like a kind of an easy time to seg into sex, because you're talking about sexual parts and embarrassing things, and next we'll talk about sex. What are you doing about birth control? Do you think you have an STD? Do you have any worries about STDs? What are those worries? No, I'm not using birth control. Well, education about HIV, education about pregnancy, education about birth control opportunities. This is where all of that comes in. And then the second S is for suicidality, homicidality. Have you ever thought about hurting yourself, hurting somebody else? Yes, I have. Do you have a plan? Yeah, how would you do it? I'd hang myself. Well, how far into that plan are you? Well, I have a rope in my bedroom. Or I've thought about hanging myself, but no, I'm not going to really do it because I don't want to die. All of the stuff that again goes with that. And then you have to make the assessment about, you know, are you going to report this patient for danger to self, danger to others, etc., because you do have a duty to report. I should backtrack and say that at the beginning of the adolescent assessment, you do want to introduce the concept of confidentiality to the patient. Although you and I understand what confidentiality is, these are teenagers. They tend to be somewhat paranoid about adults and not necessarily trust us. And you need to be honest about what that confidentiality is, and that is somewhat set by state statutes, so you need to know your state or local statutes. Depending on the law in your jurisdiction, it might go something like this. What we talk about is between you and me, unless you tell me you're going to hurt yourself, hurt somebody else, or somebody is hurting you. And then you can seg into the assessment. It may be more complicated depending on where you live and how the patients are coming to you, etc. Anyway, that is the HEADS assessment. It's a critical part of a well visit. It might be part of a sick visit too. This should not be limited to well visits. And again, I always tell my students, if you're doing a sick assessment on a patient and you have reason to wonder about some of this, then by all means ask and do the assessment. For example, patients here for a cold. Okay, I go to look in their ears and I notice, when I was in med school, we had a clinic that I was working in Hollywood, not far from Santa Monica. And we had a lot of kids living under the pier in Santa Monica coming into this clinic. Everybody knew that. So they're in for ear pain. You go to look in their ear, at some point you go to do that. You see sand in their hair. Well, they could have just been surfing. Or they could be living under the pier. Time to ask the questions. You have a 16-year-old girl come in, and she's throwing up every morning. It could be gastroenteritis. It could be stress from the beginning of the school year. It could be pregnancy. Do an adolescent psychosocial assessment. Things may have changed from your last well visit 6 months ago. So, adjust it as necessary and do it as necessary, but definitely at every well assessment, this needs to be done. If you have questions or comments, please leave them in the link. I am still taking students under certain circumstances with my current employers. You can leave messages in the link, and I'll get the links below, and I'll get back to you about that. I no longer have an office to call, so don't bother to call phone numbers. And I'll see you in the next video.